Hi everyone, welcome back to iMumz Ask Me Anything session. So today we have another interesting topic, a very relevant one. Many of you keep asking us when should the baby be rolling over from tummy to side and back. So we've heard a lot about baby milestones and reaching them on time and what is the importance basically, right? So we have Dr. Basavaraja from Bangalore. He's renowned pediatrician practicing over 20 years and specializing in everything that a baby needs. And we are very, very happy to have you here with us. So I
Thank you,
think
Ansuya.
probably you can just take over and tell them everything they should know about baby milestones.
Thank you, Dr. Ansuya. First of all, let me introduce myself. Myself is Dr. Basawaraj. I am practicing for over a period of 20 years. Today, what I am going to discuss here is about the development of child. We are all aware development of a child is a very important thing, especially first 3 years your development going to predict the future of the child. Of that, first 1 year is a much more important. As a parent, we need to be aware about the development. When we talk about a development, it is not the one domain we are going to talk. We are going to look into the development one gross motor. Gross motor means as a parent, what we need to understand is the major things of in the things where the developmental progression of in a baby usually takes from cephalocaudal direction. That means from head control to that of a trunk control to that of in a sitting and standing position. That is a gross developmental thing. So fine motor is a one thing which is related to adaptive skills. That is basically which is necessary for day-to-day functioning of those things. And the third thing is about the social things. Means as we are all aware, human being is a social animal. Social thing is a very meant like it could be starting from a social smile to that up in a saying a I bye bye, all those things which is related to the social milestones. And the other important thing is the language and cognitive function that is related to the brain and its speech. So we will discuss all these things one by one. First of all, let me take up in a gross motor. When the baby born, so if it is in a full term baby, usually will be totally lack of head control will be there at birth. And the babies, if you look at the back, generally back will be straight. If it is in a preterm means what? If the baby which is born before the completion of 40 weeks of gestation, that is the time where majority of the time babies will be hypotonic. That means back will be curved and baby will be tones and all those things will be less. So this is at birth. When the baby start growing, say at the age of 6 weeks, so momentarily it's try to lift the head. Initially, head holding will not be there. At the age of 6 weeks of the baby try to hold the head. That momentarily, that is the thing what it develops. Around 8 weeks of age, baby try to maintain the head in a same position. That is one of the thing. And by 4 months, there will be in a partial head control. And if you put the baby in a prone position, what happens? Child try to lift it the chest of the couch, and momentarily it can lift the head also. If you don't control the head by 5 months, that is the time as a parent you need to be worried. Head control needs to be, it usually starts, generally it is 3 to 4 months. Suppose if you don't control the head, holding up the head by 5 months, that is the time as an a parent we need to be more worried about it, and we need to consult the developmental specialist or a pediatrician depending upon the area in which you are there. Then by 5 months of age, baby supports the weight on his forearm. Forearm means it will take this support and baby try to bend and lift the head at the age of 5 months. And at the age of 6 months, child can support with the hand and lift the head. That means child can bear the things on the hands, and this elbow joint, this is an elbow joint which will be extended, means straight. means bending on that thing. That's how the baby. Rolling over means when the baby is, for example, if it is in a supine, if you put the baby in a supine position, by 7 months, it should be able to turn it onto the from the back to the stomach and stomach to the back. That's how rollover will take what we call it as a supine to prone, prone to supine. That is a common thing. And at the age of 9 months, crawling means baby try to move with an abdomen. And at the age of 11 months, baby creeps. And at the age of 12 months, baby should be able to stand with a support. And sometimes some of the babies can walk with her. So when you talk about the development, we need to understand the three concept things. One, what is normal development? What I said so far is a normal development. And there is a variation in the development because some of the babies can grow, achieve the milestones early, some of the babies can be late. And what is deviated? What is abnormal? Abnormal means there is in a particular age at that time, if the baby is not able to achieve that milestone, that is in a what we call it as a red flag sign. That is the time where, as a pediatrician, as a healthcare provider, as a parent, we all should be worried about that. That is means this is a three way we need to. Why we need to develop, find out the developmental delay in the baby is once if you find out the development delay, is it a normal variation? Is it an abnormal thing? If you're able to recognize that, on that basis, if you intervene the child and your long-term morbidity means the baby can cope up with that thing in the subsequent days. That's why, as a parent, you have a huge responsibility to find out the if there is any deviation from the development. That's what as a parent. When another question as a parent in a less than 1 year old child, when does the baby start sitting? Generally, baby starts with a sitting with a support around 7 to 8 months. 8 to 9 months, baby can able to sit without a support of his own support, and 9 months baby will be more comfortable standing by around 11 to 12 months, and baby should be able to walk with a support around 12 to 30 months, and baby can walk without a support 13 to 14 months. This is the time where the baby's gross motor things is there. So other important milestones, developmental milestones, which is important is fine motor. What do you mean by fine motor in a common language is it is about an adaptive skills. When you are talking about adaptive skills, so when the baby at birth, what happens? Ants are closed. That means the almost up to the 4 weeks, ants will be closed. By 6 to 8 weeks, it keeps the ants open. Then once after these things, then try to baby around 3 to 4 months, try to grasp the object. Once if the baby is trying to grasp the object around 3 to 4 months, 4 to 5 months, baby try to reach to the object with the both hands. Then baby try to reach with one object around 5 to 6 months. Around 7 to 8 months, baby transfer the object from one end to the other end. So that's how the transfer of object is take place. Then comes once this is the age group around 7 to 8 months, transfer of object will get it. And the grasp means baby takes the support of this and try to grasp the things. This is called as a crude grasp. What do you mean by finer grasp? Around 9 to 10 months, baby tries to hold the small object with your index finger and the thumb. It is holds the small object like this. So that's the time where the finer grasp things. That's how the whole fine motor things will develop like this in the less than 1 year of an age. The next domain of a development when you are talking about the things in the children's is about the social. When you're talking about the social, one of the important thing as a parent, what we need to remember, generally baby try to look at the mother around 3 to 4 weeks, try to look into the face of the mother. By 6 weeks, baby is trying to able to look at the mother and appropriately, if the mother provokes the baby, baby smiles. That's a very important thing, what you call it as a social smile. Social smile is a very important milestone for the baby to develop it. Then comes hand regard. Hand regard is another important thing. Hand regard means playing with his own hands. So why it is important? Suppose if the hand regard is persist at the age of 12 weeks, that means 3 months. Normally baby plays with his own hands till around 12 weeks. If it persists behind 12 weeks, what does it indicate? Two things. One, there may be intellectual disability, that what you call it in a medical term, submental abnormality or mental retardation, or if there is a visual, it means if the cataract or if there is a blindness, then also baby try to place with his hands even after 8 weeks. 12 weeks. Up to 12 weeks, it is a normal thing. If it persists beyond 12 weeks, that is the time as a parent we need to be aware. It could be a two reason. One, it could be because of a mental subnormality. Two, it could be because of some visual disturbances like a cortical blindness, cataract, or could be anything. Then when you're looking at a social thing, imitation, whatever the mother and father says, try to imitate it. That's how it acquires a social skill. That is around 6 months of age, imitation will be there. And around 7 months, baby provides a resistance. If you say something, baby will resist that. That's how the things. And at the 8 months, baby responds to the own name. Suppose if you call the baby, when can we expect the baby to respond back to you? Is around 8 months. 9 months, 9 to 10 months, baby is able to say bye bye, all those things. If you practice the baby can be able to do that. Around 10 months, baby is able to speak in a few things. And when you call, baby is going to come to you around 12 months of age. That is the time where baby will when you call, baby will come back. This is how the first 1 year of development is going to be there. The another important milestones as a parent, which is more important, is speech and language, and which is related to cognitive function of the brain. So with the baby, usually at birth, what happens? There will be small throaty voices and smiling will be there at around 4 weeks of the things. And by 4 to 6 weeks, baby try to laugh. That is another thing. And 5 months of age, baby is able to say ha, that type of a thing. Baby will develop it. Around 8 to 9 months, around 6 to 9 months of age, baby monosyllables, ba, so like that type of a monosyllables will be there. Around 8 to 9 months, baby can able to speak a few one or two words. 10 months, majority of the baby will speak a thing, and 12 months of age, around 1 to 2 words, baby will develop. So this is an developmental things. When you're talking about a development, we need to talk about things which is related to the gross motor, that is related to the neck holding, rolling over, sitting, standing, crawling, and walking. These are the things which is a gross motor. When you talk about a fine motor, that means the hand close. When does the hand close? When does the hand open? When does the baby is able to approach to the object? When does they able to approach with the two hand? When does they able to approach with a single hand, and transfer of object, finer grasp. These are the things which is related to adaptive skills. And social and things which is related to the social smile. And also the baby is able to say bye bye, and able to come when you call. That is related to the social speech. Also monosyllables all around 6 to 8 months, whereas in a single words is around 10 months. 1 to 2 words of speech will be there by the age of 1 year. This is an overall developmental milestones of the baby. But as a parent, we should know what is normal development, what is variation. When do you say it is deviated from the variation? That's how, when you detect the developmental things early, so that we can intervene early, so that your baby grows well. The first 1 year, it is the first 1 year is a very, very important thing. So this is all about an initial thoughts about development of the baby. So now I'll open up the session for an question and answer session. If there are any question and things is there, common things, we'll try to clarify. Over to Ansuya.
Thank you, sir. So moving on to the first question of the day. Navami is saying, hi, my daughter is 6 months, 10 days old. She rolled over at third month and now starting to balance her legs to crawl. But she's not able to crawl properly. Is there any activity to be done to help her crawl and sit?
Okay, let's understand at the age of a 6 months old baby, what are the milestones that we expected from. The moment we take 6 months of a baby, so child should be able to bear the weight on his own hands. That's the first most important thing. Neck holding, majority of the time they will achieve the things, and rolling over. This is the age where the rolling over will take. And that is the gross motor. Fine motor, baby should be able to approach to the object. That is the other thing. And when it say linguistic or speech is concerned, baby is able to say monosyllable. And social is concerned, baby should be able to enjoy the mirror image. When you show the mirror image, baby likes and dislikes, everything is going to come at the age of 6 months. These are the normal developmental time. Let's come back to the question of the mother. Here, baby is not able to crawl and creep. That usually baby takes around 8 to 9 months. Your baby is a normal development when you look at the your description things. So what you are expecting is the crawling and all. It usually takes around 8 to 9 months. As such, baby, you need not to be worried. Baby is absolutely normal. Over to you,
Thank,
Ansu.
thank you, sir. Sir, here I see a query. Hi, Anastasia. My baby completed 6 months yesterday. He started rolling a week back after encouraging for 2 weeks, but he rolled only 4 or 5 times since 1 week. Is it normal or is he reaching his milestones late? He sleeps too much and is getting very less floor time. What can I do to help?
So there are two questions here, Ansuya. So as a mother, she's right in one. Rolling over started after the just giving a training to the baby for almost around 2 weeks, and the baby started rolling over for a few times. See, this is absolutely normal child. Rolling over can start around 6 months. It can continue to around 7 months. Some of the babies without rolling, some of the babies straight away get into the sitting position around 7 to 8 months of the child. This, as far as the rolling over is concerned, absolutely normal thing in this child. So no need to worry about the rolling over of the baby is concerned. You had a second query. What was the second query, Ansuya?
Baby sleeps a lot and gets very less
Okay.
floor time.
So sleeping is another important thing. As a parent, we need to know. See, 6 months old baby generally it sleeps around 12 to 14 hours. Some of the babies can go up to the 18 hours too. So the what I'm trying to say is it is not the quantity of the sleep is important. Some of the babies sleeps for only few hours, say around 6 to 8 hours. Some of the babies sleeps around 12 hours. Some of the babies around 14 hours. The quality of sleep is a very important thing. So only thing is what I suggest you need to avoid the showing an electronic gadget to the child. We say computer, TV, mobile. These are the things in nowadays. So we are trying to see, trying to expose the child. We need to avoid those things. And if at all, if you are playing, you need to put in a light music that is comfortable to the child. So in the olden days, they used to play the song and they used to sing. They used to play with all those things that used to give in a lot of things to the brain. That's how soothing to the brain. This is how the babies used to play pen. So your baby is absolutely normal. No need to worry as far as the sleep is concerned. As far as the rolling over is concerned, both the things is normal. Only thing is avoid a thing which is irritates the brain or which stimulates the brain. Those are the things we need to avoid, like an electronic gadget, computer, TV, mobile. These things you need to avoid. Screening, basically avoid a screening exposure.
Thank you so much, sir. Sir, Hina is saying my baby is 2 months old. How do I identify his milestones when he is so young? Like when the baby is plus 6 months plus, it is easy to see baby crawling or trying to crawl. But then when the baby is tiny, 1 or 2 months old, then is there a specific identification? I think that's what she wants to know.
Absolutely. It is a very, very good question, Hina. So basically, at the 1 to 2 months of age, what are the important things as a parent we need to observe? So I told you when you're talking about a development, when you're looking at a development, we need to look at the four aspect. Gross motor means which is related to your neck holding. At the age of 6 to 8 weeks, neck will be in stride, but the holding will not come. Holding usually comes 3 to 4 months, complete neck holding. So if your back of the child is straight, you look that into things. Two, partial neck holding, baby try to keep the head in a straight position. That's what you need to look at that. Too much of lagging and all it alert you, oh, baby is having too much of extended neck is also something which is abnormal. That is one thing you need to observe as a parent. Then comes fine motor. Most of the time, as a parent, what you need to look at is the hands are open. If the persistent hand twisting at the age of 6 to 8 weeks, means around 2 months, that indicates there is something abnormal in your child. That's the time where you need to be more worried. So what you expect at the age of 6 to 8 weeks, you expect the hands to be open almost is continuously. That is what you expect, the hands to be open, no persistent twisting. Then comes other important thing, baby is able to recognize the mother and intently start looking at the mother around 4 weeks of age. That is what it is very important. And at the age of 6 weeks, when the if you stimulate your baby and if you smile at the baby reciprocate with a smile. That means baby is not laughing by himself. Baby is laughs when you stimulate it. That is called as a social smile. That's a very, very important milestones at the age of 6 weeks. If the baby does not smile at 6 to 8 weeks, that's something which is alarming. This is the time where you are more worried. You should bring it to your pediatrician's notice. Okay, this is what my observation, so that pediatrician can look into the development of the baby. That's the very, very important thing. Coming to the speech is concerned, 6 to 8 weeks, what you expect from the speech point of view, just some vocalization, say something like that. You don't expect much from the speaking. This is what the most important milestone at the age of 6 to 8 weeks is your social smile.
Thank you, sir. Yes. I think that was very helpful. So another question I see here is Suma is asking. I think Suma, you've asked for what are the developments that sir had shared. You can watch the video again on iMumz YouTube channel later. So you will get to know, because sir has explained it in detail in the beginning. Moving on to the next question. I think Joeta is asking if you can share how much a baby should sleep in the 4th week, like when the baby is almost less than a month old.
See, especially first 4 to 6 weeks of the development of when the baby is born. See, one of the pattern you need to look at that. The pattern of sleep in the first 4 to 6 weeks of the child, baby sleeps in the daytime and plays in the night time. Why it is so? When the baby is there inside the mother womb, that is the time baby is. It is like in a, say, for example, you take a rocker bottom like thing. This is the bottle you just think. So mother's womb, when the baby is there in the morning hours, baby, it will be like a rocker bottom like thing. Baby can be holded and baby will be sleep. Suppose in the night, if the mother sleeps, look at that. That is how the amniotic fluid, baby starts playing in the night time. Same pattern of habit, which will be there when the baby is born. That means when the baby is in the daytime, it sleeps more, and nighttime it plays. That's why majority of the time when you come across with the kids, with a young mother, when they're taking care of any child, sir, my baby is not sleeping at the night time, but it sleeps more in the daytime. That is one related to the pattern of the sleep. So another question, how many hours the baby sleeps? See, in the first 4 to 6 weeks, baby can sleep as high as around 12 to 18 hours. That is the time where the majority of the time baby will be sleeping. But some of the babies sleeps only for 6 to 8 hours. Is it an abnormal? Answer is say it is not so, because it all depends upon the multifactorial quality of the sleep. If it is good, that's more than enough, rather than the quantity of sleep. The wide variation is there. As long as if your baby is active, playful, and interactive at the 4 to 6 weeks to your face, your social smile, and that means your baby is quite fantastic and it is excellent.
Thank you so much, sir. Sir, Saubhagya is asking a query here. My son spoke 3-syllable words in the 4th month itself, and he tries to stand when we hold him in the arms. He is just 5 months and 3 days old. Will it impact his knees if he stands so soon? When can we encourage them with walker?
See, this is a very, very important. Saubhagya has raised in a very important two things. One, which is related to the speech is concerned. Some of the babies can start speaking at 4 to 6 months of age. Some of the babies can take around 2 years of age. Both the things are normal. There was some concept was that if the baby speaks early, your intellectual capability will be very high. So now that has been proven beyond the doubt. There is no relation between the speech and the intellectual things. These are all the wrong notions things. That's one. So that means generally we expect the monosyllables to around 5 to 6 months, around say seven to 8 months, and 1 to 2 words around 10 months, and 1 to 2 words speaking by 1 to 2 years. That's the time where you can speaking is concerned. Coming back to the when can I allow the baby to bear the weight? Generally, bearing up the weight around 6 to 8 months. If you hold the baby, bearing up weight will be there. But what I suggest you is you should not allow the baby to bear the weight. Why? There will be a bending of the leg will take place. To correct that, it will take around 3 to 5 years. We should not put the baby on the walker. We should allow the normal process to be there. We should not allow the baby to bear the weight artificially. Momentarily bearing the weight is okay, but bearing the weight for a longer period of time, that will cause us then a bending of the leg, and that will create an abnormality. I don't encourage allowing the baby to put it onto the walker. Instead of that, normal process of say around 11 to 12 months, baby is able to walk with a support, and 12 to 3 months can walk, 12 to 13 months it can walk without any support. So that is the age group. So walker is absolutely, it is not really required. So better to avoid walking, allowing the baby to use it in a walker.
Thank you, sir. I think that would save many babies from using walkers. So, very helpful. So, Shivani is asking, by which month can we let baby sit with the help of pillows or in our lap without straining her? My baby is 4.5 months old and I make her sit in my lap and she looks fine, but I just want to confirm with you.
Yeah. See, as far as the supporting this one is concerned, usually the aid support is required till the complete aid control. Generally, aid control will be around 3 to 5 months. That is the age group where the aid control will be there. Till then, you can give a support to the aid. Generally, beyond that, it is not required. What you are taking care within a support for 3 to 5 months, it is very much required. Please continue to do that. Once the baby is able to hold the neck by himself, then there is no not really required to support the head. As far as the head shape is concerned, some of the time as a pediatrician, I come across with a lot of parents comes to me with, sir, my baby's head is abnormal. It is a little bit, it is not in the right direction. Should we do something? See, normally the first head growth of a maximum head growth will take in the first 1 year of life. That means initially their head will be a little bit abnormal. So as the baby grows, it becomes a normal. No need to worry about your head size and all. So that's an absolutely normal thing. What you are taking, what you are doing at the present, it is an absolutely perfect. Please continue.
Thank you, sir. So Bhavna is saying my baby is not able to take food properly. She will complete her 7th month on 20th of April. I'm giving her meals in the noon and night and started her day with apple puree after feeding. She's taking just 4 to 5 spoons and starts making noises. She forcefully shuts her mouth and not even a single spoon after that. Her gums are also swelling. Is this normal or what do you suggest?
So your Bhavana is raised in a very, very valid things, and also this is one of the concern by the lot of mothers which comes to us. So there is what you call it as a responsive feeding. Responsive feeding is a very, very important thing. What do you mean by responsive feeding? As a parent, you need to allow the baby to enjoy the feeding. How do we make that? Majority of the time, mother or a grandmother force the baby to eat. That's one of the things which is not advocated. If you force more, it will have a more psychosocial impact on the baby. It is likely to affect the development. My advice here is don't force the baby. Other common mistakes the parent does is put the mobile cartoon or something, allows the baby to see the cartoon, then trying to divert the attention, allow the baby to feed. It is not the feeding is important, it is a pleasurable and responsive feeding is more important. So if you diverting the attention, allowing the baby to eat, that will have a big impact on the development. Please don't do that. And sometimes put the television and show some cartoons and all, trying to feed that. That's also a wrong thing. What ultimately what we should do as a parent? As a parent, you should make sure that when the baby is given in a breastfeeding, a baby should be able to enjoy your breastfeeding. Two, if you offer the feeding, baby should be able to take the feed with a pleasurable way. You should not force it. If you are forcing the baby, it will never open up. More rebellion will come. More resistance will come. That's what I said. 6 to 8 months. That is the period where more resistance will come. So you do not do. Instead of that, you talk to the baby, give a smile, and allow the baby to eat. That's how you can make them a responsive feeding. That is one. Another thing, around 8 to 9 months or 10 months, if the baby is able to sit, you offer the food to the baby, allow the baby to explore it, because this is the time where hand to mouth coordination, hand to eye coordination. It is not the feeding alone is important. Hand to mouth coordination is important. Hand to eye coordination is important. That helps in maturation of a brain. That is helps in the development of the other milestones. So we need to allow the baby to have a self-feeding pattern. If you don't inculcate the self-feeding pattern at the age of around say 9 to 10 months, majority of the time you are forced to feed the baby. You have seen the mothers even feeding even after the marriage. So I am telling it very frankly. So what I am trying to say is around 8 to 9 months or 10 months, allow the baby to eat by himself. Initially, baby will not eat. It will take around 6 months, 6 weeks to 6 months. So keep allowing it. Baby throws the food, that's a normal. Baby plays with the food, that's a normal thing. Put it onto the plate, allow the baby to explore, allow to develop hand to mouth coordination, allow to develop hand to eye coordination, allow the self-esteem to be developed. This is what, as a mother, as a grandparent, you are more interested to encourage the baby to self-feeding pattern. This is what I advise. So Bhavana, it is thank you very much. You brought out a very, very important thing.
Very helpful, sir. And I think babies are very particular about how much they want to eat. So they will not eat more than what they want, right? So I think we have to understand their appetite.
Ansuya is also a very important thing. Ansuya, so this is what important. See, majority of the time, parents will not be knowing. So baby is eating what is required for it. That is what Ansuya was trying to bring it here. So we should know that it is not the baby amount of a food is important. What is required for the baby, that's going to eat it. Your job is to supervise the thing and make the baby to facilitate it. So you should not allow look at the quantity of the food. It is the what is required for the baby, that is the amount baby is going to eat. It is not going to eat what is required by the grandmother or a mother. So baby is going to eat what is required for the baby himself. Thank you.
Mm-hmm. Thank you, sir. So Pranjali is saying, my baby is 5 months old. He rolled from back to tummy, but not from tummy to back. So are we late?
See, it is in a context in which this question is very important. See, most of the time in Indian context, we make allow the baby to sleep in a supine position, whereas in the Western countries, they'll allow the baby to sleep in a prone position. So that here supine to prone to supine, it will come. Generally, it is the way. Whereas in a Western, prone to supine to prone. This is how it depends upon the way we nurture the baby. That's the way the baby is developed. Next question comes to Pranjali's question of my baby is able to from back to stomach to back is not a touching. It is not necessarily it should come. So generally it will come from back to stomach to back. But baby, I told you in the beginning of my talk also, what I said is some of the babies will develop sitting straight away without rolling over. What I'm trying to say, Pranjali, it's a normal thing. No need to worry about it.
Mm-hmm. Thank you very much, sir. So just you just mentioned about sleeping on the tummy. So I have a query regarding that. I'll quickly get onto that. Sapna is saying, my baby is 2 months old, sleeps better when he is on his tummy. Should I let him sleep like that, or will it harm his growth in any way?
See, when you're allowing the baby to sleep on the tummy or from supine, that is on the back, both are a normal thing. As long as if there is not really required. Some of the babies prefer to sleep it in the prone position. Reason is so there is what you call it as there is a food pipe that is called as an esophagus and the food bag that is a stomach. In between that there will be what you call it as a wall. What we medical terminology we say it is a gastroesophageal reflex. Some of the babies which is having a reflex, If you nurse them into the prone position, that is prone position is sleeping onto the prone stomach, they will be more comfortable. They will enjoy that type of a nurturing. So you can encourage it. So even medically, we encourage to allow them to sleep it in a prone position when there is a reflex. So there are some of the babies, normal reflex is going to be there. What we call it as a physiological thing. That is not an abnormal. Everybody will be having that reflex. So they'll be more comfortable in that. So if you are comfortable, your baby is comfortable with the prone position, it is not going to interfere within your development of the baby. Please continue to nurture your baby within a prone position. It is no harm in that.
Thank you, sir. So just connected to this, trying to, because a lot of mothers will have a doubt. So we often hear that the chances of SIDS, right? It is high if the baby is sleeping on the tummy. So that is the general notion. So would you also like to address this since we are talking about it?
Yeah, this is a very, very important sudden infant death syndrome. That is what we call it as a SID, sudden infant death syndrome. Especially if you are allowing the babies of an abnormal baby or premature baby, allowing to nurture in a tummy. That is the time. Sometimes it will have anything, but our Indian context, majority of the time, we nurture in a back side. So back is on the supporting thing, so it will not be an issue at all. But it is medically, it is not indicated. If the baby is not comfortable within a prone position, no need to nurture the baby within a tummy.
Thank you, sir. Sir, Vasundhara has asked a very important question, and we keep getting this question. I'll just take it up. My baby is 3 months old, and nowadays he keeps his hand in the mouth. What should I do? Even when we try to stop him from keeping the hand in the mouth, he starts crying out loud.
Okay, this is another thing. Keeping the ants in the mouth, even 3 months, 4 months, 5 months, especially when the teeth comes, it is more important. Why? There will be a lot of itching sensation. Baby wants to bite something before the teeth comes. That is the time where they're trying to offer in a something as a teether and all. It is not medical. It is not advocated. What your baby is doing, keeping the ants into the mouth, it is a normal thing. You need not to do anything. Only thing when the baby keeps too much of ants into the mouth and playing on the floor and keeping into the mouth, that is the time where gastrointestinal infection like a diarrhea, pneumonia, those things can come. But it is a normal thing. Please don't do anything. So no need to worry about that.
Thank you, sir. So Jagriti is asking, my baby is premature and born 1 month before. Will this affect his developmental milestones? Will baby reach the milestones late?
This is one thing where I did not address an development in a case of a prematurity. So Jagriti is raised in a very important thing. See, prematurity. Suppose if the baby is born at 30 weeks, so normally what we expect baby to be born at 40 weeks. From 30 weeks to the 40 weeks, when you are calculating the milestones, we need to minus that. That means ultimately, if you what is the postnatal age? That means when you're talking about your preterm baby, you say 32 weeks plus 2 weeks of extra this one. So that means it is not going to affect the development. One, two, and it is not going to affect the growth. Growth is affected only if the baby is having what we call it as a symmetrical IUGR. That means because of some medical conditions where the baby's whole growth is affected in the first trimester, but in first 3 months or the first second trimester, that is the time where the symmetrical growth because of some genetic disorder and all, that is the time growth is affected. The moment we talk about a growth, it is the length and height and weight and its circumference. That is a symmetrical growth. If it is affected, then it will not have it will have an impact. Whereas asymmetrical growth, that means if it is just born prematurely, otherwise development is quite okay. Catch up growth and development will be there. By the age of 2 years, almost everything is going to be normalized. Your baby is going to attain the milestones normally. So no need to worry. Only thing when you're calculating the thing, you should calculate 36 weeks plus 3 weeks, means after 40 weeks, that is the corrected the gestational age. Depending upon that, you need to look at your milestones rather than looking at the from the birth to this one.
Thank you, sir. That is definitely helpful for her. So, Ankita is asking another question. I think there are a couple of more questions on sleep. My baby is 3 months old and sleeps only for 6 to 8 hours maximum and does not sleep during the day. I'm worried he is not getting enough sleep.
I think this question I have already answered. Once again, I'll explain it once more. See, as far as the sleep is concerned, we need to understand the two things. One is what is the quality of this sleep, two, quantity of the sleep. There are some babies where the quality of sleep is quite good, means undisturbed, and even a 6 to 8 hours of a sleep at the age of a 3 months is quite normal. There are babies which sleeps for a 12 to 20, 12 to 14 hours or sometimes 12 to 18 hours. That is also normal. It is the quality of the sleep is more important rather than the quantity of the sleep. That means 6 to 8 hours is also normal. 12 to 20, 12 to 14 hours or 12 to 18 hours is also a normal sleep. That means duration of the sleep is not an important thing. It is the quality of the sleep is very important. That is one point. Second thing, coming to the my baby sleeps more in the daytime as compared to the night time. I told you some of the babies normally adopt to the normal sleep pattern by 4 to 6 weeks. Some of the babies can take bit longer period of a time. So at the age of a 3 months, even if sleeping more in the daytime, it is not an abnormal unless your baby is not active, not playful, just sleeping all the time. That is the time it is in a worrying factor. Where what is the worrying factor? Sometimes hypothyroidism baby where voice is disturbed and sleeps more in the time, more both in day and night time, and not active, not interactive, not playful. There is a constipation, means baby is not passing the stools in a frequently. Those are the babies where we need to think about a thyroid disorder. That is, hypothyroidism is a very important thing, and other metabolic disorder where baby is dull, active, not playful. That's the time where you are more worried about the metabolic disorder, hypothyroidism, and other medical condition. In general, sleeping in a daytime, 3-month-old child is not an abnormal thing. It is not the quantity of the sleep. That means duration of sleep is important. It is the quality of sleep is important. So your baby is absolutely normal. Looking at your question, so I can say it is a normal.
Thank you, sir. So, Hina, baby is 2 months old. She says, I've noticed if I repeat some animal sounds to my baby every day, he starts smiling and recognizing them. Is it a good sign in his milestone?
See, Ina is previously is also done one question at the 2 months old child. So to continue to there are two things I did not focus on my initial introduction. As a mother, we should observe is the baby is able to see. When do you expect the baby is able to see? I told you at the age of a 4 weeks, baby is able intently start looking at the mother. At 6 weeks, the baby smiles. Around say 8 to 12 weeks, that's the time when the baby looks at some particular object, eyes will move and baby is able to trace to the object. Around say 60, 90 degree to 180-degree, baby is able to trace to the things. So what your baby is when the pet comes is looking at the pet and all, that means your hearing of your baby is quite normal. To vision, if the baby is able to track it, that means vision is normal. That means your baby's vision and hearing is a normal thing. That's what indirectly it is showing. So you should be very happy about that. So it is your baby is absolutely normal, Ina.
Thank you, sir. We also have a lot of activities designed for babies to do all this tracking and all that. So I would request all the users to go practice it probably for 5 minutes every day so that we can stimulate the growth together. Now, sir, one question I see here, Kavita is saying, whenever my baby is sleeping, he is sleeping on the sides. If I try to make him sleep on the back, he starts crying out loud and he sleeps entire night on one side. He is 4.5 months old. Is there anything to worry?
See, 4 to 5 month old child sleeping in the side. It all depends upon the baby's comfortness. That is first thing. Second thing, we need to look at the medical condition. What are the medical condition where the baby is having an uncomfortable if he's sleeping on the back is what you call it is a myelomeningocele. Myelomeningocele, some parts of the brain which is coming in the back side. That type of a child will have an abnormality and all. I don't see in your child that type of a things to be there because anything myelomeningocele means it is able to see seen by the parents. That means it is not there in your child, and unless there is some abnormality in the back, most of the time baby sleeps comfortable on the back, and sleeping on the side is not an abnormal thing. Your baby may be comfortable on that position, you can continue. But when you're going for the immunization to your pediatrician, just you can bring it to the notice. If there is no abnormality in the back and sleeping in the side, it is not an abnormal thing, it's a normal thing only. But you need to rule out the medical condition because it is little unusual to sleep on the side at the age of 4.5 months. It is not a normal thing. But once you rule out the medical condition, sleeps on the side, no need to worry.
Thank you, sir. I see two questions on vaccination. I'll quickly take that up. Dr. Gawai, she's saying, is it compulsory to give TCV vaccine in the 6th month?
So TCV vaccine, basically the moment we talk about TCV is a typhoid conjugate vaccine. So see, majority of the time in the past we used to give a typhoid conjugate typhoid vaccination after the age of 2 years. This typhoid conjugate vaccine has come just 5 years back. To be precise, around 10 years back, we started using routinely around 5 years back. Initially we started using at the age of 1 year. Then we looked into the study. Okay, it can be used at 9 months also. But whatever the studies which is available, you can use it at the 6 months. It is not compulsory that you need to give it at the 6 months. This is the age group we say 6 to 9 months you can give it. Why we should say 6 to 8 months? India is a developing country. Generally, in a developed countries, where the typhoid is a very common after the age of 2 years. In Indian context, even it is less in a it is a common in less than 1 year old also. That is why we advocate even at the age of you start giving in a conjugate vaccine at the 6 to 9 months. It is not compulsory. If you give it, it is a very good thing. You can go with the TCV vaccine, that is typhoid conjugate vaccine.
Thank you, sir. So Kavita has one more question. I missed all 3 PCV vaccine and my baby is 4.5 months now. Please tell me when to give the PCV vaccine now.
So Kavita is right, and one more important thing. This is what some of the mothers misses the PCV, that is pneumonia vaccination. What you call it is a pneumococcal vaccine. If you are giving in a less than 6 months old child, what is the schedule internationally accepted is we give 3 doses of a PCV vaccine, that is 4 weeks apart. Then we give a first booster dose at the age of 15 to 18 months. Since your baby is already 6 months, more than 6 months, what I suggest you, given a two PCV vaccine, that means 4 weeks apart, and 1 booster dose at the age of 15 to 18 months. That means totally 3 doses required. Generally, it is a 3+1. In your case, it is a 2+1. If the age of the child is more than 1 year, then we say 1+1. Give a 1 dose, after 6 months, you give another dose. So this is how the recommendation is there with an international recommendation, which is advocated by WHO, Indian Academy of Pediatrics, even American Academy of Pediatrics. This is the recommendation. As the age is more, that is the time less doses is required. Younger the age, it is more doses is required. You can go ahead with a vaccination, Kavita. It is very much required.
Thank you so much, sir. Sir, moving back to milestones, there's a question here. I think usually we get queries that baby is not rolling and all that. But here Pragna is saying, my baby is 3 months old. She rolls over more often. Is it normal or is it too early?
See, there is a lot of normal variation in the development of children. So rolling over, generally what we expect between 6 to 7 months, that is the age group where rolling over is quite common. Baby rolling over at 3 months, little unusual. I'm not going to say it is an abnormal, provided if your baby's tone is normal. Tone means some of the babies will be hypertonic, that means increased tone, especially in a cerebral palsy and all. That is the type. Early neck holding is the thing. Early neck holding is not a neck holding. We expect it to be around 3 months, 3 to 4 months. Neck holding, if it is acquired early, then we say, okay, this is abnormal. This is the time where I need to look for the cerebral palsy and all. 3 to 4 months, 3 months, it is too early to develop in a rolling over at the 3 months. It is looks little unusual, but it is not that it is abnormal. It is a normal variation of a development, but provided if you look at your baby and when you are taking the baby for a vaccination and all, please bring it to your pediatrician's notice. So I'm looking at your question. I'm sure it is a normal baby, but however, when you're taking the baby to the pediatrician, please mention that my baby is rolling over. That is the time where pediatrician can take some time to assess the development. Is the tone normal? Other development is normal. Rolling over is not an abnormal.
Thank you very much, sir. A quick question from Anushka here. Can we fly if my baby is 2 months old?
Yeah, the 2 months old crying is a normal thing. It is a very, very, very much normal. No need to worry, Anushka. That's a very, very normal.
Mhm. Thank you, sir. So Mansi is asking, what should be the ideal weight of a 2.5 months old baby if her birth weight is 2.1 kg?
Generally, doubling up the weight, it will be there around the 3 to 5 months. Some of the babies quickly acquire doubling up a weight, some of the babies. But in an average, what is the normal weight gain in the first 3 months of the child? The baby gains the weight of around 20 to 25 gram per day. Even some of the babies can, what I'm saying is an average, some of the babies can gain around 30 to 35 gram, and your baby's expected weight at the 2.5 months is around 900 to 1000 gram. That means 1 kilo per month. That comes to around 2 kilo. So if your weight of the baby is around at birth is 3.5, you expect it to be around 5.5. If your baby is sleeping 2 to 3 hours after each feed, that's a normal. And gaining a weight around, say, anything between 800 to 1000 gram in the first 3 months, it is a very much normal thing.
Thank you, sir. So Navami has one question. She says, "Hi, thank you so much for responding to my previous question. My baby was born in the UK and I was advised to just give D3 drops. My question is there anything else to be given like iron or other vitamins that I'm not aware of? Will this affect any of her milestones? Thank you."
See, as per the international recommendation of an American Academy of Pediatrics, Indian Academy of Pediatrics, and the many international recommendation, vitamin D3 is the one of the thing at birth we do advise. That is one. If the baby is a premature baby, that is the time 4 to 6 weeks we advise an iron drops. Otherwise, generally we don't advise iron drops. Once you start in a complementary feeding at the age of 6 months, that will take care of an iron requirement. That is the other thing. What about other vitamins? Generally, it is not required if the mother is giving a breastfeeding properly. There is no need for a vitamin, other supplementation of vitamin apart from vitamin D3. Sometimes we do supply the calcium and phosphorus. That is another thing. Calcium and phosphorus recommendation. Calcium in the 2, phosphorus is the 1 ratio. That's what we recommend. But vitamin D3 is the only thing which is required. Otherwise, breastfeeding, then at the age of 6 months, you start a complementary feeding. Majority of the vitamins and micronutrients, what is required by the baby, generally it is sufficient with the breast milk and complementary feeding.
Thank you so much, sir. I think we've covered almost all the questions they had asked, and you've been extremely patient and replied to all their queries. To all the users who joined late, if you would like to watch the session, um, I will share the YouTube link with you, or you can just go to iMumz YouTube channel and get the link for sir's session. Uh, okay, I think. There are a few more queries. Okay, we will revert to them. I think Sridevi is saying my baby is 4.5 months, still not rolling over. Sir has already addressed this. So if you could just watch the video, right, sir?
Yeah, perfect. I have explained so many times.
Okay, so here one query is my baby's one testicle has not descended yet. Doctor has said to wait for 1 month and we can go for surgery at 6 months. Wanted to know if it is safe to go for surgery or will it move down on its own?
See, one of the important thing, if the test only one testis, if the other testis is not there, we need to do the ultrasound where exactly the testis is there. Pediatric surgeon is the right person. Suppose if the testis is unlikely to be descended, we need to go for the archodopexy. Because reason being, the archodopexy means pulling back the testis into the scrotum. That is what it is very much required. Otherwise, complications will be very much. It can develop into the testicular cancer. It can develop in infertility. It is a medical emergency. You just follow up with your pediatric surgeon. If he is advised after 1 month, please go for surgery. It is a quite safe. No need to worry about undescended testes. It is a very safe procedure. It will not have an except routine complication. It will not have a much complication in a safe surgical end.
Thank you very much, sir. I think that is the end. We have come to an end of this session, and the users are very, very thankful. They are constantly writing on chat that it was very insightful to have a discussion with you, though they could not ask you directly. I have tried to take in all the queries, and we look forward to having more sessions with you. I see the users are having a lot of queries related to sleep, so we have a session coming on sleep on Tuesday. So stay tuned for that, and I will share the details shortly. And for responsive parenting, responsive feeding, we have a session on Sunday. So do not miss that. It is with one of our co-founders, and he'll talk to you all about why it is important to be responsive in everything that comes to the baby. So we will try to cover as many issues as possible. Thank you so much, sir, and we look forward to having you back with another insightful discussion.
Thank you, Ansuya. Thank you very much. Really enjoyed answering all the questions. I hope it is very useful to the parents, and they can watch on the YouTube. Definitely, they can get a benefited out of it. Thank you. Thank you so much.
Thank you, sir.
Thank you. Thank you.